Okay, going into week 5, we're going to do the lecture part for the Masters in Healthcare Administration 575. And first, I just want to share some information about data sharing. One thing to keep in mind is you need to have that high-level overview. So we're needing to make sure that we have information that is succinct, it's to the point, it's very info-packed, and visually it needs to be very easy to grasp and to digest, or easy to focus on those top priorities. You're needing to share a lot of information at times at maybe leadership meetings or board meetings, even at staff meetings. So again, you want to make sure that you're including all your staff so they are seeing some key points of information, because they can have some very good improvement ideas, and also just so they have a pulse check of how you're doing and where you need to progress. Also, with the data sharing, keep in mind that you're looking at successes, you're looking at opportunities, and the data, with looking at it visually, if you put it in a nice format, it can make it very easy to quickly at a glance grasp all that information. It also lets you know over time, if you have some trending information, how are you doing? So it's always really good to have some of the information presented where it's got that over a time span, so you can see year over year, or quarter over quarter, how you're progressing. So I do have some dashboards and scorecards we're going to look at. And there's multiple areas on these tools. So again, I don't want you to get too much in the weeds with the information. I'll go through those with you, but I want you to really look at the amount of information you can really gather at a glance, that visual cue to your eyes, where it goes in on that color coding. The color coding, again, just keep in mind, it's for a visual pop. It's for that ease of analysis and review. And also keep in mind, when you're looking at the data, is it timely? Is it something concurrent, or is it done in real time? Or is it something it's older, it's retrospective? So those are components you need to keep in mind with looking at data. This information, I know it's a little blurry, so I really just want you to concentrate on the color. The graph area that's over to the left, it has kind of a gauge on that one, and it has the color coding, the red, yellow, and green. This one with the yellow, usually that kind of means they're progressing, so they're moving in the right direction. Red usually is for attention. It means, stop, you need to make improvements if you're not going in the right direction. And then they have the two shading of green. So the lighter green meaning that they're doing well, the darker green meaning they're really exceeding expectations and doing extremely well. So over to the right, it is displaying a pie chart, pie diagram, and again, it's just another way to present the information. You really need to make sure when you're using some of these tools, some of it comes in software that's already canned and out there, and will spit these graphs and these bar graphs out for you. Sometimes you need to manually do it. Sometimes you can do that with some information in Microsoft Office, such as Excel or Access, where you can create this and get some of the color coding to coordinate with what you set as far as parameters within the cell in that spreadsheet. Some of that can get pretty complex, and if you don't use it a lot, it's hard to retain that information. I'm seeing more and more, though, at bigger organizations, they do have more of the canned reports and spreadsheets where it will automatically spit out this information, and then the software having it where you get these nice tools and this nice appearance of a display to share with information to who your audience is. So this is another one. This is a little bit more clear, but you can really see that you're looking at that it has some bar graphs with the green and purple bars, and it's showing as far as an actual budget on here versus what the actual budget was, so actual versus budget, and they got the color coding. It has a trend line in the left hand side on the bottom with variance versus percent variance. So that trend line that they have going across the bar it kind of is showing where they had a dip in cash flow and then how it came back up. So again, depending on what you're looking at, that can be very significant to kind of see those trend lines. Over to the right, you see some gauges, and they've got it listed right under the executive summary dashboard. So they have several different things they're looking at. They have assets, cash flow, I don't know if that's incorporated statement, liability. So again, specific to what your business is, there's going to be certain, items, whether in this case it being a gauge diagram, that's going to really help you to know if you're progressing, if you're not, by a quick glance at that dial. Also, they have kind of the bubble diagram. So the little bubbles in the lower right hand information, those two, I've got another example I'm going to show you, but again, kind of just give you a pulse check of where you're going in a different way to view it. So this one, we have the color-coded bar graph and the pie chart. And the one thing in the upper left-hand corner, you have bars that are turquoise, green, and kind of a yellow golden color. So what can be interesting is you can have 3 points of data in just one bar. So I think that's good to be aware of. You got your pie chart, again, that has that color coding, and so you can really make it pop depending on how you want to best present the information. Sometimes if you're in Excel, you can play around with which type of way to present information. So I could maybe go in there and play with whether I thought it displayed best in a pie diagram or in a bar, or just how it made most visual sense when I was looking at it, knowing what I was trying to display to that audience. Also, I think the lower right hand corner, I kind of like the way they have that with the arrows, the blue arrows going up, and then they have kind of their baseline and then the arrows going down. So again, just depending on what message are you trying to quickly get out there, there's a lot of different ways that can be considered for the presentation. This one, we're looking at some color coding again in the one row that's under the differential percent, where they have kind of a tan color, some kind of pinkish and pink or reddish, and some variation in green, kind of to see if they're moving in the right direction. It also has the arrows to the far right in front of the month, and they're kind of going up or down. I see that a lot with stock exchange information, on the news even. And then about in the middle of the page, it shows you 12 months, and it's showing you a trend line. So you can kind of see the variation of the line going up and down. So again, it kind of gives you that over time span of how things are progressing. So they can give you a lot of information on some key elements, some key data points over 12 months of time, but you're only looking at one data sheet or one scorecard. So again, that's kind of the value of using this type of format. The bubble diagram is in the upper left-hand corner. So they have this where each bubble represents a different specialty line item for what they are looking at. And then you go to the other areas. They're also looking at various types of tools with bar graphs. Some of them are a little bit busier with the amount of data points they have included on the bottom, which is actually the x-axis. So like where it says worker or item or tools on those 3 bar graphs, the bottom flat row where the bars are coming up from, that is actually the x-axis. And then to the side going up where they have the 3,000, 2,000, 1,000 on 2 of them, and then on the one in the middle of this page, it has 800, 400, and 0. That area is the y-axis. So we'll get into that a little bit more in future weeks, but just to kind of give you a quick mention of what the x and y-axis, what those are in these that are displayed. So again, a lot of information, a lot of color coding. Some of it's really pleasing to the eye that you can quickly look at this and then be able to absorb the information. So integrity and accountability. Um, Data transparency is very important in healthcare. We can't improve what we don't know about. So if we don't know it, if we're not measuring it, we don't know how well we are doing or how poor we are doing. We also need to have open sharing, that being within our organization. We also can do so outside of our organization with other healthcare providers. This can lead to big improvements. It can lead to better accountability and high integrity. The other thing with that non-compete, which I'm going to talk about I think on the next slide, is just we can learn from each other. You don't need to recreate the wheel. You just need to be aware of where you have opportunities, so then you can go out and seek more information and then make improvements and make strides in the right direction. Validation, also known as inter-rater reliability. You might hear that inter-rater reliability called IRR. And it is internally and sometimes externally where you're getting reviews done. How we use this within the hospital setting, just to give you an example, we want to make sure we have apples to apples. So when we're doing our concurrent or real-time abstraction for our core measures, we have where we're doing, for example, let's say we're doing the chart review. All the PI coordinators who are doing this data abstraction, they are using the same specifications, which is our Bible. It gives us the regulations that the Joint Commission, the Centers for Medicaid and Medicare Services, in this situation for core measures, what they're telling us to look at. And we're all supposed to be interpreting it, not only within our hospital, but every other hospital across the nation in the exact same manner. If there's a question, if something is not clear, they actually have a query hotline that you can submit questions. So again, a lot of checks and balances just to ensure the validity of that information. It's important because you want to make sure that what you are sharing, what you are submitting is correct and is accurate, and you want the same integrity with any other organization that you are being compared with. So you want to have that apples to apples comparison and interpretation. So that is why that validation is so critical. It also is important because you want to make sure that on situations where, based on how you do with your data collection and data submission, if you're getting some reimbursement based on it, I want to make sure that we're maximizing, that we're doing a good job and we get what's owed to us per se. But by the same token, there could be some unethical practices. So again, that validation, inter-rater reliability, it also helps to keep facilities honest. So the specifications, I already mentioned Joint Commission, CMS, but also the Agency for Healthcare Research and Quality, NHSN, which is that National Healthcare System Network, NDNQI, the National Database for Nursing Quality Indicators, the Hospital Engagement Network. All of these organizations have specific guidelines, standards, specifications that we are all to follow if we are participating in any of these areas. So again, that consistency, to have that in place across all the facilities nationwide. Data collection systems in healthcare. These are just a few. I'm not not by any means thinking that I'm capturing all of them, but there's Hospital Compare. We have health grades, and health grades is really looking at helping the consumer to get the right maybe dentist or hospital or physician, to kind of give them a pulse check of where to go for patient satisfaction, also experience and or quality. They have also the National Database for Nursing Quality Indicators. Within that, there's also a RN survey that the facility can participate in annually. The Joint Commission, we go to that site. They have survey information, certification information if you want to do that for specialties. There's the Hospital Engagement Network, which is also drilled down to a state level, but also a national level for quality data submissions. Leapfrog, they do annual surveys, and then you can throughout the year do updates to that site to keep it current with what your organization has in place. Anthem, Blue Cross Blue Shield, they also call that QHIP. They are conducting surveys with healthcare facilities just to get comparative data to see how you're doing, and then to use that to gauge yourself against other organizations. Also, that National Healthcare Safety Network that I mentioned, they are another data bank. CDC is the one for Centers for Disease Control. They are the ones that have initiated that NHSN. QualityNet is a CMS website. And I just want to mention with QualityNet, they have very high security. They're constantly turning it over where you have to reset your passwords. You have to go through a lot of checks and balances before you get clearance to be able to be an administrator for QualityNet. So that meaning being able to access through a secure network a rapidly changing security code that you have to copy and paste into the site along with your password, along with your email address, to get into the site. And they do that again to protect the consumers and to the hospital, so that if there's a breach, it's not going to be very likely that someone's going to get very far because of the high security and the frequent change that they're requiring with that revolving security code and with your ever-changing password. HCAPS, the Hospital Consumer Assessment of Healthcare Providers in Systems, again, just another means of data collection. So as you can see, there's so many ways that we collect data in healthcare. And again, just always trying to improve. Some of these areas you can get information on certain specialty items. Some of it you can drill down. Some of these sites might be a little bit heavier regulated than others, but again, they're all data systems that we have in healthcare. I did put a few asterisks in this slide. I don't think that we always think about, but when we're doing surveys for patients, or if we're doing even employee surveys, we have to be very respectful of the confidentiality and the protection that we owe those participants who are taking that survey. So the questions, they do have to be formatted and presented in a systematic, consistent manner to maintain the integrity of the survey. There has to be specific wording of each question, so you're not trying to word it certainly a different way to one person, especially if you're doing a telephone survey, and then word it different to someone else. That could skew your data. That could allow for some misinterpretation and could again cause a flaw in that survey. So there has to be that integrity. The other part I mentioned scripting in here. I know you have to be very careful with the hospital consumer assessment of healthcare providers and systems, that you're not misleading a patient. And what I mean by that, when they're in the hospital and you're trying to meet their needs with answering questions and having a quiet environment, meeting their pain. The federal government, they're very specific, and along with the Agency for Healthcare Research and Quality, that you're not dictating to the patient how they should answer a question. You can do some scripting, but they're very specific on how you can word something and what's allowed and not allowed to prompt a patient while they're still in your facility, for then once they get discharged and take the survey. You just don't want to have an integrity that's been misguided for that patient. So I thought that was good to know. You can read more information about that through the CMS site that talks about HCAPS. But again, I don't know that we always think about just protecting the integrity of the survey and keeping it blinded as far as like if employees are completing those surveys. Again, you want to make sure that there's a non-bias and that those employees are going to feel comfortable participating in those surveys as well as a patient. So, leader and staff engagement. We talk about servant leadership, and I really appreciate servant leadership. It's leading by example. It's basically setting the bar high with how you conduct yourself. And all of you that are participating and getting your master's in healthcare administration, I feel like you are servant leaders. You're out there, you're wanting to lead the pathway. The Greenleaf organization is really the go-to site to get more information about servant leadership. And it's kind of a managerial style, but also I think you can do that with your friends, your family, your kids, leading by example. Huddles. This is a quick way, it's a brief meeting to have a focused agenda. So you're going to do a quick review, a quick discussion. Some examples we have at the hospital, we do a morning huddle, and there's some very key data points they're talking about. They want to know, do we have any pressure ulcers that have surfaced? Do we have any falls that have happened? Are we having any challenges with any patient placement? Are we having any challenges with any kind of central line infection? And those are just a few things that come up. But it's really focused, and so again, you're getting a lot of quick information in a short period of time with the key players at the table. Sometimes they call this a stand-up meeting, and they do that because, again, they want it to be very quick, and people get in there, stick to the agenda, review what has to be reviewed, make quick decisions or discuss what needs to be done, and then move on with your day. Another example is a post-fall huddle. So let's say we have a fall in the hospital. Right at that moment in time, we want to make sure that we're reviewing what happened, what could we do to prevent a future fall, where did we have failures, and so that, again, that we can take notes from that and apply that to future successes so that we don't have a repeat occurrence. Rounding. This is when you will see maybe leadership on a unit going around to patients and just doing a pulse check of how is their stay going. Are they seeing their leaders on the units? Are their staff rounding on them, or coming in and checking on them every hour? Just finding out how are things going. They also can do patient safety rounding. That can be different people. It doesn't have to be all leadership doing that. We can have frontline staff that are also engaged with doing patient safety rounding. You can use a checkoff tool and make sure that they know what are the safety things that we're looking at on the units. Also survey tracers rounding. So there's a multitude of rounding that you can do. You can really drill it down to be very specific so that you have a very narrow focus, that when you hit a unit you want to look at maybe 3 things, and that's what you're focused on for that day. And then in your calendar put reminders out there so that you stay on track with when you need to round and take care of it, just acknowledging that you're staying on track from a patient safety perspective. Handoff. We've talked about handoff with report on patients, and we've talked about using the S-bar as kind of a guide with the situation, background, assessment, and recommendations for a patient. But I want you to also think about between leaders or between just staff members. What if I go on vacation? I need to make sure that what I have maybe coming up the next week, I am making someone else aware of, because they might need to help support me during that week when I'm on vacation. We have new leaders that come into place, so we need to make sure that they have a good maybe guide to follow for when they go into their new role, that we have a good onboarding process, which is another means of providing some orientation specific to their role. We also want to make sure that if someone leaves a position, that we don't have a gap. So you're always wanting to look at, do we have strong handoffs? Is there areas that we need to improve continuity within our organization? We want to prevent having any weak links. So just really think about that. It doesn't It does not do anyone any good just to sit on information and not share it, and not have even kind of a guide of what your specialty top items are that you have responsibility for, whether it be your job description, a competency checklist, or the utilization of both. And then keeping that pretty strong with, where are the resources that you use, maybe to do reports, what software are you using, all those kind of tools that help you be successful at your job. Just always be thinking about cross-checking, cross-training others so that, again, you don't have gaps should someone be on vacation or should an emergency occur. Patient safety initiatives, you need to keep in mind that non-compete. It is a patient safety forum that allows open sharing. If there's an issue, I think it's prudent that I share that with other organizations when we have our regional meetings, or if we have a state meeting, because what I learn from a situation, I can share that with another organization, and I can promote patient safety, and I can prevent a harm event from occurring for someone else. So it's sharing those occurrences and sharing best practices. We don't have to recreate the wheel. It is okay to share, and it is okay to keep moving forward. Everyone has very similar challenges, so we need to help each other out. Networking, I think you need to keep in mind that with healthcare, we have our expertise within our own departments, within our own facilities, our own hospitals, extended care facilities, home care agencies, whatever the forum. But we also need to make sure that we don't get caught in a bubble or in a vacuum. We need to reach out and really keep enhancing those contacts outside of our facilities. There's many expert leaders in the community and beyond. And we also can help with doing mentoring. What a huge compliment that if we have a skill set or we have a knowledge base, that we can reach out and help others to grow. I think that's very rewarding, and it's the right thing to do. Evidence-based care. In healthcare, the research, it's robust, it's dynamic, it's ongoing. We need to encourage staff at whatever level we are working to be very engaged in realizing research is going on. Are we following the most current based studies? Is there superior care that we should be providing that maybe we're not doing yet? We also need to make sure that we're providing that evidence-based document to the practitioners if they're not ones to really maybe be moving forward with how the ship is guided with evidence. We need to make sure that we keep giving them that evidence and keeping them on track as well, and or facilitating with other peers so that they as a group can keep supporting each other and moving towards supporting the evidence-based practices within the facility. I just think it's very important because things are moving fast and furious, and we want to stay most current so we do the best for our patients.